webinar on With Everyone Else, Fundamentals of Community Inclusion and Participation and Implications for Coordinated Specialty Care. My name is Liz Thomas, and I'm an assistant professor in the College of Public Health at Temple University. I'm also an investigator in the Temple University Collaborative on Community Inclusion. We are a national research and training center that's funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. And we really focus on promoting community inclusion and community participation among people who experience psychiatric disability. My work in this center focuses in particular on young adults and transition-age youth that experience serious mental health conditions, including those with first episode psychosis and those who are participating in coordinated specialty care programs. So looking forward to bringing some of the work we've done in the center to this discussion today. I did just want to give you all an update that we did just today get confirmation that we are able to offer CEs to certain license holders in the state of Pennsylvania. So this will be on a later slide, but if you are an LCSW, LSW, LPC, LMFT, or MFT license holder in Pennsylvania, you can receive up to 2.75 credits. To receive credits, you do need to participate in all 3 sessions of our webinar and complete an after-course evaluation. And you'll need to email our social work department. We'll put the link in the chat to request CEs after the webinar concludes. So very excited to be able to offer those to you all. So I'm joined today by Bodie Bodenhammer and Hannah Wells. They're both critical facilitators of this webinar series, and I'm going to turn it over to Bodie to introduce themselves next.
Thank you, Liz. Hi, everyone. I'm Bodie. I'm a certified peer support specialist. I'm actually in the state of North Carolina. So this is now a multi-state collaborative, which is exciting. I've been working as a peer support in first episode psychosis in an outpatient clinic since 2017. So I actually do work with coordinated specialty care. And I'm here to kind of help facilitate the peer support role in the kind of conversations that we're having. And I'm really looking forward to hearing from you guys what your experiences have been like. I also wanted to let you know, we have a few different ways you can participate today. If you are interested, we would love to hear from folks. We are going to have the chat going. Hannah's going to be wonderfully helping me look at the chat. We also are going to have a poll, and we have some breakout rooms coming your way. But you are welcome to also use the raise hand feature or use the reactions as you would like to. So just so everyone's aware. And with that, I'll pass the baton to you, Hannah.
Thanks, Bodie. Hi, everyone. I'm Hannah. I work with Liz at the Temple University Collaborative on Community Inclusion. I work as a knowledge translation and intervention coordinator, and so I have the really cool opportunity to support trainings like this, and I also work a lot with parents who experience mental health challenges, and I also work with providers to support them to promote community participation and living. Excited to be here.
Great. And as Hannah said, she's going to be kind of our tech support today. So if there are questions, if you're having trouble with hearing us or participating, please feel free to reach out to Hannah. All right, with that, we will get started. I just wanted to give a quick acknowledgement to NIDLR, our funder, for making this webinar series a possibility and for funding the research that we'll talk about in our presentation today. So here is our agenda for the next little while. We're going to start off by talking a little bit about what we mean by community inclusion and community participation. These are terms that can be interpreted in different ways by different people. So we just want to kind of share with you our perspectives about what we mean by these terms. We'll talk a little bit about why we feel that it's important to promote community inclusion and participation from a few different vantage points. We'll share with you some of the research that we've done in the collaborative as it pertains to young adults and community participation. As Bodhi mentioned, we do intend for this webinar to be maybe a bit more interactive than a typical webinar, and there will be opportunities for discussion, for breakout rooms, etc. And at the end, we'll talk about what's coming up next in our next session next week, and about this TA opportunity that we're offering as a follow-up to this webinar series. I did also just want to say that much of the content that we'll talk about today is absolutely relevant to coordinated specialty care, to CSCs, but we also hope that if there are those joining us who aren't within the CSC field, but work with young adults with serious mental health conditions, that this content will be applicable to you as well. All right, so community inclusion. So this is a pictorial representation of different concepts like inclusion, exclusion, segregation, and integration. So we'll start on the bottom left with the exclusion circle. So in this circle, you'll see the green dots who represent a group of people who are able to participate in the community in some way. Maybe they're working, going to school, parenting, engaging in leisure or recreation. And the dots outside of the circle, the colored dots, represent people who are excluded from participating in some way. In the middle circle, you'll see the concept of segregation represented. So here you see two circles. And in the big circle, you see the green dot people, again, who represent people who are participating in the community in some way. And then there's a smaller circle with the multicolored dot people who were previously excluded, who are participating now, but they're doing so away from the green dot people. So an example here in the mental health field might be sheltered workshops in which people are working within mental health agencies. They aren't working with people who don't experience a mental health condition or a disability, but they're participating in work. In the bottom right, you see the concept of integration represented. And this is the concept that is really at the foundation of our laws and policies here in the United States. So here, again, you see the green dot people participating in some way, and then you see the colored dot people participating within the same circle. They're working in the same environments, perhaps. They're going to the same schools. They're going to the same community centers. They're participating in the same places as the green dot people. But you'll also see they're still sort of concentrated within this larger circle. So they're still participating, but they're doing so in a way that's a little bit different. Maybe they're treated differently in some way, provided accommodations so that they can work or go to school in the same places as other people. They're treated differently in some way due to their uniquenesses. At the top, you see the concept of inclusion. So inclusion involves the green dot people and the multicolored dot people participating in the same environment and in the same way. Inclusion differs a bit from integration in that inclusion means that you're in an environment where you as a person with a mental health condition or some uniqueness, some difference, are welcomed and embraced. The context, maybe the employer, the community center, the library, welcomes and embraces you. And the environment says, we want you here, we need you here, you make us better by being here. Inclusion really is a concept that we should aspire to. And it's a concept that is discussed in many countries throughout the world, Europe, Australia, Israel, for example. But again, here in the United States, integration is really behind most of our policies and laws, and it's important as well. Both inclusion and integration have in common valuing people's uniquenesses and creating opportunities for people to participate just like everyone else. So moving on, what do we mean by community participation? So community participation has been referred to as the choice and action that individuals make to be active and valued roles in the communities of their choosing across a variety of domains in their lives. This can include being involved in work and school, in different kinds of relationships, family relationships, friendships, intimate relationships, parenting. It can involve leisure and recreation, religion or spirituality, if that's important to people, and civic engagement, voting, volunteering, advocacy, community organizing, all of these activities and areas that are critically important to many of us, but can be challenging for people that experience mental health conditions. I think Bodhi was going to facilitate a discussion at this point.
Yes, thank you. So we were going to make this one pretty quick. You can use the chat or raise your hand if you want to speak with us, whichever one you're more comfortable with. But the question I was like really curious to hear about from you guys is what examples can you think of related to young adults community participation? You know, as far as the broad scope of what community participation means, making it a little more concrete.
Lori says voting, athletic recreation leagues, working a job, volunteering, youth group, club, socializing, teaching and treatment.
We also had finding belonging.
Yep.
We also found finding belonging in neighborhood, faith, school, or healthcare.
Tournaments.
Being with non-paid people that choose to be with them. So some of those natural supports.
In my community, young adults have various events such as the Trey and Boo basketball tournament named after victims of gun violence. That's an incredible thing. I love to hear that. I might steal that idea. Give it to some people in the community who play basketball.
Walking groups, going to church, national parks. Lots of really cool examples here. I think this also just highlights the diversity in terms of what people are interested in doing. All right, so thank you for your participation in that quick discussion. We're going to talk a little bit now about why we should promote community inclusion and participation in the first place. Why are these concepts critically important, especially for people who have received a diagnosis of a serious mental health condition, and especially for young adults? So first of all, we're going to approach this from a couple of different vantage points. First of all, we argue that community integration is a right. It's a right in that it is something that the United States has recognized as a human and legal right of all persons. It's the opportunity to live in the community and be valued for one's uniqueness and ability. And the importance of this concept is underscored in policy as early as the Community Mental Health Act of 1963. I think Bodhi wanted to say a few words about that.
Yes, thank you. I, in doing my research about the Community Mental Health Act, which was introduced by President Kennedy, it was supposed to fund 3 years and $150 million worth of community-based mental health treatment, specifically to provide a community-based option for those who had been in long-term state hospital care. So it was, getting people out of the state hospital and into the community. and the conditions in the hospitals were bad, and that was part of what they were trying to address. So this is the notion of deinstitutionalization. And this is the first time it was introduced into the US policy, like any mental health or care, any healthcare related policy. Psychiatrists at the time were acknowledging that medical treatment wasn't enough. They were starting to really see that they needed to consider social and community related problems that contributed to their patients' low quality of life. It was an optimistic time for new medications as well. So part of this Community Mental Health Act went to educating the community as well at large about mental health, about the needs of the people who were trying to be reintegrated into their communities, deinstitutionalized. This really set the stage for the notion that those who suffered within the state hospitals deserved a space in the community, and there was a space that could be made for them. And it was also critical for their recovery outcomes. The other thing that stood out to me is that part of the reason that President Kennedy was so enthusiastic about supporting this particular bill wasn't just that there was optimism in psychiatry at the time and all that. He also had a sister who experienced, her name was Rosemary Kennedy. She experienced a lobotomy as part of her mental health treatment at the time, and it severely lowered her quality of life. So to me, that was interesting because it speaks to the power of lived experience, both Rosemary's lived experience and Kennedy's experience as, brother and caretaker and part of her family. So that stood out to me, and I wanted to make sure to emphasize that from the peer support role, that that's part of what motivates us.
Thanks, Bodie. So then fast forwarding to 1990, the Americans with Disabilities Act classified integration as a legal right. And then this right was further reinforced by the Supreme Court's Olmstead decision in 1999, which found that unnecessary institutionalization is a form of discrimination that's prohibited under the Americans with Disabilities Act. And Olmstead set off a lot of different policy actions after that in the federal government. For example, President Bush put forth the new Freedom Commission in 2001 and the new Freedom Commission report in 2003. So the bottom line here really is that community integration is a legal right. And from that perspective, it's important to promote. But we would also take this a step further. We think that community participation is not only a right, but it's a medical necessity. This Well Together document that's depicted here in this slide was something that was developed by the Temple University Collaborative in collaboration with an organization in Australia called Wellways. And this kind of articulates some fundamental concepts and theories underlying the importance of community inclusion and participation, and also talks about the evidence for the medical necessity of community inclusion and participation. So we just wanted to point this out. Some of what is in this document is going to be shared in this session later on, and then in our upcoming 2 webinar sessions. The argument for medical necessity is also based on a number of theories and concepts that are out there, like the World Health Organization's International Classification of Functioning Disability and Health, or ICF framework, in which participation is viewed as a critical dimension of health and health functioning. This framework helps us view participation as a key element of health. And it talks about health in 3 different areas, or 3 different domains: body function and structure. And if we're thinking about breakdown in body function and structure, we might think about a broken arm or problems with people's brains. Specific activities in this middle box here includes things like grooming, budgeting, being able to dress oneself. And then on the right-hand side, we see participation. And according to the ICF, participation refers to involvement in a social situation. So that might be being a student, going to church, synagogue or mosque, voting, anything that includes social interactions and meaningful activities. And ICF really is considering participation to be something that's a key driver of our overall health. Finally, we just wanted to share why we think community participation is particularly important among young adults who experience serious mental health conditions. If we think about this developmental period of young adulthood, this really is a time when identity is forming, people are starting to exercise more autonomy, making more choices for themselves, and community participation is a way to test out and solidify our personal interests, our social roles, our identities. But we also know that young adulthood is a period of relatively high risk for the onset of serious mental health conditions, and that this can interrupt or delay the pursuit of community participation goals and interests. For example, it could prolong attainment of educational achievements needed to secure and maintain competitive employment. And we know from research that young adults with early psychosis in particular, who don't receive treatment designed to minimize illness-related disruptions, AKA coordinated specialty care and related approaches, those who don't receive these services are at greater risk for health problems and poorer functional outcomes as they age. So this further supports the notion that community participation is a medical necessity among young people in particular. Finally, a focus on life goals such as work interests, educational attainment, relationships. This is viewed as a facilitator of engagement in mental health services and particularly coordinated specialty care. There was a qualitative study that a colleague of mine, Alicia Luckstead, conducted as part of the National RAISE study, in which young people were talking about this, that when clinicians really focused on, and other team members really focused on what was most important in life to young people, this kept them motivated to keep coming back and receive services. So assisting young people with developing and pursuing their community participation goals is likely to promote their meaningful involvement in services and long-term retention and care. So now we're going to share with you all a little bit about some of the research that we've done in the TU Collaborative related to community participation among young people with serious mental health conditions. The first study was a focus group study that we conducted several years back. It included 11 participants, some of whom were from a coordinated specialty care program. Others were from a residential program for young adult men. And the goal of these groups was to elicit a broad range of community participation areas and activities that young people considered to be important to them. And as you can see from this slide here, participants identified a number of different things they were interested in. There were 16 unique participation areas, such as education, employment, relationships, and then 58 specific activities that people said were important to them. Something that really stood out to me was going online to socialize and get information. Notably, this study was conducted prior to 2020, and I think the pandemic has made online participation and online communities that much more important to young people and people who are older as well. Something else that stood out to me from the study was all of the different iterations of sports and artistic activities. We heard about lots of different things in these areas that young people were interested in. Oh, Bodhi, I think you're still on mute.
Do you ever hit the wrong button?
Yes.
Yeah, all the time. I have a poll. I'd really like to hear what you guys think. There's no right or wrong answer, so don't, we're not grading you. You don't need a number 2 pencil. But we wondered, other than going to work or school, what community participation activities do you believe are most important to young adults? And you can pick all of them that apply in your opinion. And the results are based on the study. because we all know work and school are important, right? But we were kind of going deeper into that with these questions. I see a lot of votes for doing things for fun and time with friends and family. That makes sense, right? Right. Are our votes tallied, do you think? I'll leave it to you, Hannah.
We go ahead and end and share. There you go.
Yeah, lots of spending time with friends and family. That's a big one I've noticed too. This is interesting. I think you guys probably hear this stuff from them. A lot of dating. That's something that has come up recently in my work too, which is really interesting. Less so on volunteering in places of worship and voting. This is really cool, guys. Liz, do you have like the outcome?
Yeah, so I'll move on to the next slide and share from a study that we did. Again, this was several years back, pre-pandemic, where we compared community participation in terms of what people were doing and their interests in different age groups. And this can shed some light on, at least in our sample, what young people were saying was important to them. So there were 879 people involved in this study, 105 of whom were between the ages of 18 and 30. And we compared the amount, importance, and sufficiency or satisfaction with community participation across these different age groups. And these were three kind of primary findings about young adults. So we found young adults tended to value and spend more time working and going to school compared to middle-aged or older adults. So that's not terribly, surprising from a developmental perspective. But on average, young people reported only about 5 days a month working and only about 2 days a month going to school. So they really were, what was surprising was that they really were reporting a relatively small amount of participation in these areas. So point 2 here is that we found that at least 70% of young people also said that running errands, going shopping, going to a place of worship, and spending time with family and friends were important to them. So consistent with what you all were saying in the poll, a lot of us agree that family and friend relationships are very important to young people. But perhaps maybe going to a place of worship or engaging in spiritual activities is more important to young people than we might think as well. Finally, the last bullet point is we found that compared to those older, young adults were less satisfied with the amount of time that they were spending participating in various areas that were important to them. So on average, only about 36% of important areas were considered to be done enough. So I think these findings really highlight the need for mental health services, the need for coordinated specialty care programs to support young people with their community participation. I'm going to cover one more study here. I did just want to give a heads up. We're going to be going out into breakout sessions here in just a minute, and Hannah's working on getting those set up. But I'll cover this one last study before we break out into the rooms. So this was a project that is wrapping up currently, in which we aim to better understand what coordinated specialty programs do or could do to promote community participation among young adult program participants. Again, in a broad range of areas. We know many CSCs are focusing on work and school, but the goal here really was to figure out what they're doing related to these other areas we've been talking about as well. So we worked with a national group of stakeholders. In fact, some of you might have been a part of that group. That included some young adult participants of coordinated specialty care, their family members, and CSC thought leaders. So administrators, researchers, clinicians, and we worked together to develop this list of criteria on which to evaluate CSE programs and figure out what they're doing to promote participation. We use this online platform called CoDigital, which is pictured in this slide, to generate this list. And once the criteria were developed, we translated the ideas from the stakeholder group into a national survey of CSE programs to sort of to quantify and get a sense for what programs are doing. And then we followed up that national survey with some qualitative interviews to take a deeper dive into examples of things that various programs are doing to promote participation, and to get a sense of implementation factors, things that supported programs and being able to do those things, or barriers, things that were difficult for programs to get around when striving to promote community participation. So in the next 2 sessions, next week and the following week, we're going to be discussing some fundamentals of community inclusion and participation. And we're going to be providing some examples from these qualitative interviews about how they can be put into practice in CSEs, and how CSEs might be able to navigate some of these implementation challenges.
All right. I'll take it. I got it. I'm keeping up today. So this is for our breakout rooms that we warned you about. I hope you're all ready. But I really wanted to have you guys discuss these questions, and then in about 10 minutes, I'd like to have you all come back and have somebody, you probably will get voluntold, to report what it is that you in your room you discuss, because these are interesting questions to hear from folks who are practicing in the field right now, what their answers are. So Hannah's going to drop them in the chat, but I'll read them for you. What are some of the most significant barriers to community participation among young adults with serious mental illness? So the barrier question. And then what are you currently doing at your clinic to facilitate community participation among your young adult clients? Hands back. I would love to hear what you guys talked about. So Hannah, if you will be kind enough to keep an eye on it. If anyone wants to unmute or raise your hand, we can unmute you for you.
I can share.
Okay.
So our group broke out, and basically there was 2 big barriers that we discussed. The first being transportation, which I'm sure most people in the room will understand. And the second that we identified was kind of the day and times of groups. So going back to the first one, some of the things that our organizations are already doing right now, Medicaid rides, the bus, like bus passes. Here in Missouri, we use the Oats bus as well. And then one of the organizations talked about Uber and whatnot, because that does seem to be, we're talking about youth that maybe don't necessarily have a driver's license or a car yet, or, access to transportation, et cetera. And then the second was the date and time. Something that we found is, even though it may be for most people, they can attend it on that day and time, but there could be some that can't. And it's just, there's not another option really, because majority can meet at that day and time. So we have those kind of miscellaneous individuals that unfortunately it won't work for them to attend those day and times.
So accessibility, I guess.
Yeah.
Yeah. I've believe it or not, I've had that problem in my own life, and of I am privileged, I think, that I get to take, actually Tuesdays are my day off from my day job. So I'm doing things like this, doing my self-care, and I designate that time to go to my own therapy appointments because I can during the day, and finding someone who will see you at the end of the day or whatever it is hard.
Yeah.
Yeah, you hit on all the high points. I wanted to say Uber Health is a thing. I don't know if everyone here knows about this. I'm just learning about it the last couple of months. I believe your agency has to sign up for it.
So it's called Uber Health because that was a question we asked, who foots the bill for that?
It's usually your agency. That's the point, I think, is to help provide folks with accessible transport. let me double check it. Yeah, it's Uber Health. So yes, your health. I'm not sure if there's an option for a patient individually to sign up for it or not. I can look into it because I'm interested in it. But
I would like to know more, and anybody else I'm sure that doesn't know about it, because I didn't know there was an Uber Health. I didn't know that existed.
right, I just found out about it recently. So yes, your agency can sign up and get like connected with it, and then connect your patients who are, need transportation to their appointments. And an Uber driver will come and pick them up. And the agency is the one who usually, at least the version of it I'm aware of, pays for it. If I were able to and I needed transportation, I think the idea of having an individual patient sign up for a plan for it would be cool too, but I'm not sure if they
Yeah.
offer that or not yet. I love the idea that if your agency is willing to budget for it, you can help because, yeah, affording transportation is the other part when you don't have it yourself, or if you're like me and you like panic every time your car has a problem or whatever. So thank you for those things. Yeah, Uber Health is a thing I'm learning about, and I'm actually trying to convince my clinic to maybe sign us up for. I think that would be really helpful.
Well, and we mentioned Medicaid rides. Somebody else piped in, and I thought it was just a Missouri issue, is it's Medicaid transportation. We do all the things. We teach the skills. We help them set up the transportation and, do it ahead of time. And they're out there waiting for the, transportation that never shows. And then when we contact the state about, hey, this person did all the right things, we've taught them, they're capable, they're doing it, and then nobody's there to pick them up for said date and time and appointment, that's not a them issue, that's the transportation issue. And apparently that's not just Missouri. There's other states experiencing similar.
Yep, we are having that. So thank you. I wanted to point out before I ask Kathy to speak, Emma in chat has said you believe it's only available in certain areas, potentially more urban areas. That's possible, but I would highly recommend you can go to uberhealth.com. I'm going to and do some research. That's what I'm going to do to see if I don't know if that's true or not. I wouldn't be necessarily surprised if it was, but yeah, I think it's worth us looking into it as an option.
Definitely.
So thank you for that point, Emma. I appreciate that. Could be true. But yes, uberhealth.com, check it out. Kathy, did you have your hand up next?
Yeah, so I'll just add a few things. We had a great group discussion that our group came up with. Some of them were the logistical things that Latricia mentioned, but resources in general for the family, for the participant, for agencies. And we also noted some differences in how agencies are interpreting what CSC funds can be used for. So that's a real sticky wicket, I will say, because a lot of agencies interpret that it can't be used for these community participation kinds of venues or food or things like that. Another really interesting barrier that I thought was something we should be considering is one of the folks on our group who is in a peer support role themselves. They observed that sometimes being around people in different stages of recovery, it can kind of draw people forward, or it can kind of, she noted, make people kind of uncertain or uneasy. And so that is something that maybe should be considered as a person's stage in recovery. And another interesting observation, that just the fact that somebody is in a treatment setting and what that means to them in terms of their identity formation. What does it mean to take meds? What does it mean to have to walk through this door? That came up in our group. And so those were some of the barriers. I think we're also kind of talking about solutions. So we talked about different things that people are doing, like in our place, we have something called Pizza and Planning, where people do get together, and they've generated a very long list of things they'd like to try. We've had dating groups, community groups, like getting out into the community and experiencing things together, where be it Frisbee golf or a civic event or, some kind of arts event. I think another barrier though is, that I'm trying to find it on my list here. Darn it, I'm not finding it real quick. Oh, that one, I kind of spoke to this, and I don't know if anybody else has experienced this, but we do a lot within our programs to create activities for community activity, inclusion, and participation. But I think sometimes where we kind of drop the ball or we haven't figured out the method is how those translate into the world outside of our four walls. That people often don't seem to have the confidence or readiness or tools. Somehow we're missing it. So I really hope that these webinars, and Liz and I have worked together for a long time, that are going to help us kind of figure out what we could be doing differently or what we could add or subtract from what we're already doing. So that's what we got. I'm sure I missed something. So if anybody from my group wants to chime in, please do.
Oh, that's amazing. That's great. Yeah, you hit on some other high points. Yeah, and I think that's an ongoing discussion. We'll kind of talk about it more over the next 2 webinars, and Liz will tell you about the TA opportunity where you could do that more in depth coming up. So yeah, thank you. Those are good questions for us all, I think, for me, and I'm dealing with similar questions and things at work at my day job. I said as though it's not day, so it's good to know we're all in the boat together. I did want to say, Scott, I think you're next.
Oh, hit the wrong button. Yeah, we covered quite a few of those as well. It was a really good discussion. I think an overarching theme also was like stigma and just that feeling of acceptance into their community, especially for young people are so aware, right, of how other people are kind of paying attention to them. And so we know that's a difficulty. I think something that I always think about is how we can still get caught up on symptom remission over functional recovery. So I think that's a huge hang up. And then some of the all people feeling isolated and not having kind of like those social supports to kind of step into the community. It sounds like there's a lot of good work going on in DC. They're doing some like wraparound support. Kind of the therapists are covering many different domains, whether that be job interviews, job readiness, supporting groups, kind of community outings, like other people have talked about. Their nursing teams or some nursing teams are providing nutrition education. And I think some of the therapists, at least in Michigan, are starting to be better at like assessing what's in the person's community already, helping them connect to the things that are already existing, rather than us kind of generating something for them. So I think those are some of the things that we covered. If there's anything I missed, group, feel free to fill that in.
No, those are great. Thank you so much, you guys. I want to say we have like 4 minutes, so I wanted to ask about Hope. You have your hand raised, and then we got to wrap up and let you guys know more about what's coming.
Hi. Our group, of course, mentioned transportation, and then I look at disability through all disability through a social model. So I thought that the misconceptions or the lack of knowledge that society has about people with all disabilities, and especially, mental health disabilities, it's like nobody thinks that they have to understand. They can't see it, so it must not be worth it. And then one of the ladies was saying that they have a manual that lets people know what's going on, where it's going on, what time, which I think is really neat, because a lot of times people don't participate in stuff because the information doesn't get to everybody equally. And I told them that I have a team, and we work with organizations and facilities and venues to make people's events and programs accessible, but not only accessible, but inclusive to people with all disabilities. So their trainings include the correct etiquette, language, overviews of different disabilities. And they include what happens if someone's having a mental health crisis. How can you de-escalate? How can you give them dignity? And I think if organizations find a way to partner, because there has to be, we're doing stuff from the inside. There has to be somebody that reaches out to the community that we're expecting these people to go out into and be successful. And that's it.
Thank you. No, community partnering is something I'm seeing more of here in EPNC, which is my my like statewide organization in North Carolina. So yeah, those were all great points. Thank you guys so much for sharing. Just to let everyone know in the chat, if anybody wants to share, I don't think we're not going to disseminate your personal contact information, but if you guys want to connect to each other, please share in the chat. And we will do as much as we can over the next couple to connect folks who want to be connected. But Liz, I'm going to hand it over to you.
Great. Well, we will wrap up today just with a quick overview of what's coming up next. I mentioned the CE opportunity. So again, if you are a certain license holder listed here in the state of Pennsylvania and you want to receive CEs, please make sure you attend all 3 of our webinar sessions and complete an after course evaluation that you'll be sent after the webinar concludes. You'll also need to email our social work department. The email address is here to request CEs. Our next session next week is going to be on fundamentals of community inclusion and participation, and we'll start talking about some ideas for practice, things that you might want to integrate into what you're already doing, and some ways to navigate some of these implementation challenges we've been talking about. And then I also wanted to mention our technical assistance opportunity. At the conclusion of this webinar series, we're going to be selecting up to 5 programs to participate in more concentrated TA with our group over the next year. TA will be free. It'll be covered as part of our grant funding. And the specific activities will be determined in collaboration with your program. But it could include brainstorming about things you might want to try, providing consultation and feedback. It could involve a learning community where we get together as a small group with other CSEs that are participating in TA, and we talk together about things that you're doing and problem solve together about any challenges that are coming up. And we will be sharing with you all a survey at the end of the webinar series where you can indicate your interest in TA. So we want to thank you all again for your time coming today. This has been a great first session, and we look forward to seeing you at the same time next week. Thank you all so much.
Thank you, guys.
Thanks so much.